Today's topic is very dear to all of us women, and it's a hormonal health. It's a perimenopause and menopause. Is it a hormonal chaos, or is it a new phase that we can master together? So we're going to learn what is perimenopause and what is menopause and how do they differ. What are the key hormone shifts driving symptoms and imbalances, and what are those symptoms? This is really important. And what are the functional medicine strategies to support the balance and long-term wellness? Because we spend, for some of us, it will be half of our lives in the menopausal state. So how can we maintain ourselves and maintain our health, preventing deterioration and aging and maybe stabilizing our symptoms? And then we're going to end up by announcing some of the news in our practice. So just for your information, we have patients who are already, I'm sorry, the people in the audience, some of them are our patients already, existing patients, and some of you probably just contemplating if you want to become a client of our practice. So we have a variety of their people here. So we're going to start with their little definition. So what is the perimenopause? The perimenopause is actually a transitional phase before we enter menopause, and typically it can occur anywhere from 40 to 50. But honestly, I can see early in younger women who are expressing their symptoms of perimenopause. And the symptoms of the perimenopause usually start very gradually. They kind of start very subtly, but with their maybe cycle getting a little bit irregular, maybe a woman start having sleep changes or mood shifts. Maybe she start noticing that her libido is not the same, but then it can take anywhere from 4 to 10 years before we entering the actual menopause. And this graph on your screen actually outlines really well what's happening with our premenopause. You can see that there's a cyclical equal period of the spikes of their estrogen that is depicted in the pink and progesterone that is depicted in the purple, and then there is a menstrual bleeding in between. So this is your typical cyclical pattern of the cycles when we are in our childbearing age. And then we start gradually entering perimenopause. And perimenopause is when we start getting cycles that are irregular. Maybe we start skipping some of the cycles here and there. And then eventually we entering a menopause. And menopause, we're going to talk about it, as you can see on this graph, is when we stop cycling our hormones. The hormones basically going either to very, very low level. Estrogen obviously drops very much to their zero. And progesterone effects actually is lost even earlier. So even in the perimenopausal stage, we see that hormones of the progesterone are going really, really low, and the majority of the symptoms in the perimenopause are associated with the lack of progesterone, which is a very calming hormone. But remember, it's also cycling. It's also not steady. So, and the menopause is the next phase. The average of women are in America that enter menopause are about 51. And that's when women go through the very significant transition. And the menopause will be officially announced when woman loses her period for 12 months. So if your last period was in September of 2025, you are still considered to be perimenopausal, even if you didn't have any periods since then. So, but at 12 months mark, which could be in September of 2026, if there's no cycle, no bleeding, no spotting, then you are officially in menopause. And this is kind of a permanent cessation of the menstruation. And understanding this transition actually will empower women to embrace this new chapter with confidence and care. As I said, we are transitioning and transforming from the caterpillar to the butterfly. And that's, I like this analogy because it gives a lot of hope. And there's a lot of good things coming with menopause, of course, but there's some also bothersome symptoms. For example, we get this sleep disturbances, we get mood shifts, we get more anxious, we get more irritable, everything bothers us, low mood or emotional hypersensitivity, we start crying for no reasons, or we now start worrying about things that we never even thought about. The problem is that cognitive changes really become a troublesome concern because we start getting this mommy brains, what we call, right? Memory lapses, brain fog, we cannot multitask anymore. And it's probably one of the really significant symptoms that will give away our unstable hormonal state. But of course, the hot flashes and the night sweats and the temperature dysregulation, also the stubborn weight, particularly in the center of our belly, that no matter how much you're dieting, you just can't get it off. And that mostly estrogenic symptoms, when estrogen fluctuates and still we have significant amount of estrogen, we might even get breast tenderness and bloating and fluid retention. And of course, sexual concerns, no libido, vaginal dryness, and even pain during the intercourse. So all of those symptoms that we never even thought about when we were in premenstrual age, in the childbearing age, now become an issue. And life becomes not as easy as it used to be. Not that it was easy before, but now it's becoming even more troublesome. So what can we do? And just want to say a few words why we experience so many symptoms during the perimenopause. It's because almost every cell in our body has an estrogen receptor, estrogen and progesterone. And that's why when we lose that stimulation with estrogen, we get symptoms everywhere. We get symptoms in the eyes. By losing our corneal elasticity, we get dry eyes. Our skin becomes dry and dull, and we start getting wrinkles, and we're losing that rejuvenational effect of the collagen that is constantly being replenished. Acne can actually get worse or can get better. But breasts change the size, shape. They filled up with the fatty tissues instead of the glandular tissue, and they become saggy. And liver, believe it or not, our liver loses the blood flow and loses the volume, meaning that their capacity of the liver to detoxify is also decreasing. The liver loses its regenerative capacity and increasing the inflammatory markers, and increases as a result an oxidative stress. Of course, there's many genital urinal symptoms. Some women cannot stop having this urinary tract infections. The whole pelvic floor is changing, and unfortunately, some women will experience their urogenital prolapse or dissension of their pelvic organs, their atrophy, their vaginal pH is changing, and we are much more prone to some vaginal infections. So muscle tissue is being lost because we're not unable to build the muscles as easily as before. And of course, osteoporosis and bone resorption or degradation happens much faster than the bone rebuilding. All of those functions are affected by estrogen and progesterone. Risk of Alzheimer, cognitive problems, mood disorders, hair thinning, getting weight in the places where we don't want it. Even the lung capacity is decreasing because of their lack of estrogen stimulation. Cardiovascular system. So all of a sudden, we get high cholesterol. We equalize our risk of cardiovascular disease with men. So historically, we know that men have a higher rate of heart attacks, right? And they develop them much younger. We are protected by our cycling hormones from the cardiovascular diseases because until we lose those hormones. And that causes cardiac remodeling. That's why a lot of women will start getting AFib or atrial fibrillation or some of the cardiac arrhythmias during the menopause. Arteries become stiffer, and we're developing more vascular changes in our circulation, and also our gut changes as well. So as you can see, we cannot say enough about importance of maintaining that estrogen and progesterone for our body. So in the functional approach and integrative management of menopause, there's some priorities. First of all, we don't start with the hormone replacement therapy right away. We need to talk about what is your level of inflammation? What is your level of allopathic load, meaning how much toxin have you accumulated throughout your childbearing age? And do we need to deal with it? Because if we have a lot of toxins, we need to get rid of them. Otherwise, our estrogen is going to become a toxin as well for our body. We need to support the endogenous hormone production and clearance. Believe it or not, some women in menopause still produce estrogen in a sufficient amount to stimulate those organs, and they do not experience a lot of menopausal symptoms. We also need to look at the resilience and restoration of systemic functions. This is important time for any woman to think about nutrition, think about the gut health and microbiome, think about detoxification and prioritizing the sleep, because that's how our brain is restoring itself and repairing itself, detoxifying itself. And then once all those factors are addressed, we can talk about hormone replacement therapy. It is highly effective when it's individualized. And different women need different hormone replacement therapy. Some women need just testosterone, and some women need progesterone and estrogen, and some women just need progesterone. So it's not one size fits all. We need to read the woman's body. So, and it's when we use hormones, hormone replacement therapy, in the frame of the functional medicine, we usually get safe outcomes and the best results. And the modern bioidentical options are safe and well tolerated for many, many women, when there's, of course, some contraindications. But I also want to say that recently I've learned about cycling hormone replacement therapy, and I think we're going to hear more and more about it. But it's basically mimicking a reproductive cycling hormonal level during the months. So yes, it will get involved the bleeding. And some women who choose this hormone replacement therapy will cycle until they're 90. So it's not for everybody, right? But we'll hear more about this. And I am trying to get more and more data on the cycling hormone replacement therapy and see the benefits of it. And the data is very, very interesting. So stay tuned. I'll share with you more. But continuous hormone replacement therapy is getting more and more acceptance. Even in conventional medicine, we see pharmaceutical companies jumping on board and creating variety of their hormone replacement therapies for women. One thing I want you to learn is that oral hormone replacement therapy, oral estrogen, is not safe. So we are trying to not prescribe oral hormone replacement therapy because that's when it causes a lot of side effects like clots formation and other issues. So of course we need to test women. We need to test where the particular person stands with all the variety of the hormones. So we need to check the hormones for menstruating women, those women who are still in the perimenopausal stage. We want to test their hormones on the day 19 or 21. That's when we test estrogen, progesterone, testosterone, pregnenolones. For women who are concerned about their fertility, we will utilize day 3 of the hormone testing. and we'll test estrogen and FSH. But remember, our female hormones do not live in isolation, or our female and male hormones, our estrogen, progesterone, and testosterone. They live in the symphony with other hormones, things like thyroid hormones that are heavily related to our sex hormones. Also, don't forget insulin and glucose regulation. That's why some women will benefit from not just fasting insulin testing, but also continuous glucose monitoring. And some women will find that managing their steady glucose level will reduce a lot of the perimenopausal symptoms. We need to test hemoglobin A1C, the marker that shows their sugar level in the past 3 months. Cortisol, not often is being checked in the conventional testing. And we need to test cortisol not just in the morning in the blood, but we need to really look at the rhythm of cortisol secretion throughout the day. The normal pattern of cortisol is when we wake up, it's the highest, and as the day progresses, the cortisol is supposed to wind down, and it should be almost zero by the time we go to bed. That will provide a restful onset of sleep. And it should remain low until 5 o'clock in the morning or 6 o'clock in the morning when the body is getting ready to wake up. We also check the sex hormone binding globulin, which is the protein that carries hormones in the bloodstream. We check free and total testosterone. We must check lipids. Why? Because cholesterol is the precursor for majority of those hormones. It's a precursor for pregnenolone, for progesterone, for testosterone, for estrogen, and cortisol. So that's why we need to look if the woman has enough cholesterol to make those hormones on her own. And no wonder that body will compensate by increasing the cholesterol and total cholesterol in the perimenopause, because body's sensing that we don't have the end products. We don't have enough estrogen. We don't have enough testosterone and estrogen and progesterone. So we need to increase their precursors, which is the total cholesterol. So now think what all those low cholesterol lowering medications do to your hormones, right? And then, of course, don't forget nutrients and minerals. Those are absolutely essential for synthesis of their normal hormones, the normal amount of hormones, and for their detoxification of those hormones. So all of those things are extremely important if you want to evaluate a woman in perimenopause. So remember that perimenopause and menopause are the whole body transition. It's not just hormonal deficiencies. Symptoms are modifiable with the targeted root cause strategies, addressing the gut, addressing the sleep, addressing the movement, and nutrition. And the early intervention really protects the long-term health. I'm talking about the effect of the hormone replacement or the balanced hormones on the bones, on the heart, and the brain. And the most importantly, a personalized plan beats a one-size-fits-all approach. So it has to be done specifically for you, not a one-size-fits-all. So I want to just present a woman who came to me. Sarah was 62 when she came to me, and she was in menopause for 10 years. And she still had some hot flashes. She, of course, progressively developed worse and worse sleep quality. She started gaining weight, but lost her muscle mass. Her body composition test was really not in a great place. She developed vaginal dryness and brain fog, and she has no prior history of hormone replacement therapy. So just completely naive. Her overall health is good, but she describes that high stress from work and caregiver responsibilities really getting the best out of her, and her resilience becoming less and less. So yes, that sandwich generation, right? Kids on one side and parents on the other side. The demands are higher, but reserves are smaller. And so her menopause rating scale was pretty high. So this is a good questionnaire that we administer in the office. It kind of gives us an idea of how is the woman doing? How's her overall menopausal symptoms? Is she handling it well or not? And it's a great tool to track their symptoms as we implement variety of their interventions. So as you can see, there's symptoms that are affecting the body, psychological symptoms, and urogenital symptoms. And she scored pretty high on many of them. So it's a high symptoms burden, and majority of her symptoms are in the body. So hot sweats, hot flashes, sweats, sleep problem, depressive mood, all those things that are way too common. So we recommend it in the first visit. We did the proper testing. We put her on the mitochondrial food plan, which is the high protein, low carbs, and lots of vegetables. We did some conventional testing her thyroid, testing her vitamins, minerals, and basic markers like complete blood count, checking her liver, kidney. Sometimes things show up there that are not supposed to be, right? And they need to be addressed. And then we start nutritional and hormonal support with the supplements. We did not jump on the hormone replacement therapy right away, but need to be addressed the basics, the diet, their toxicity, and sleep. So on the second visit, just with the diet and basic supplemental support, she reported fewer hot flashes. She felt like her mood was more stable, but she still has some persistent insomnia. The test results, of course, showed low estrogen, progesterone, testosterone. She's been in menopause for 10 years. But when we tested her cortisol, it was kind of flat on the morning, but at nighttime she would wake up. And that will keep her up way past her bedtime because now she's getting energy to go and do things. So that nighttime cortisol elevation is the real problem for us because that's when we start feeling energy, but it's actually should be an opposite. We should go to bed and get restorative sleep. No, we start working, right? Because everybody's asleep and we get the burst of energy. And she also had the low DHEA, which is another precursor for cortisol and other sex hormone. Her thyroid was normal, but she had low iodine. So that's important to replenish all those nutrients and minerals and vitamins and fat-soluble vitamins, water-soluble vitamins, which is mostly B vitamins, and et cetera, et cetera. So the next step in Sarah's treatment was discussing bioidentical hormone replacement. And what are the bioidentical hormones? Those are the hormones that look exactly identical to yours. They're synthetic, but the exact copy of what your ovaries used to produce. So we did also additional tests. We looked at her microbiome, we looked at her blood and saliva, and we did the genetic test because I'm always interested, how this woman handles toxins, how she's handling inflammation, how she handling hormones. Because if I'm going to give her exogenous hormones, I want to make sure her body and her liver that shrunk, as you remember, is able to process it and she can excrete it with her body because we do not want those hormones to be recirculating through their gastrointestinal tract back into the blood, and she is in a double dose at that point, right? So recirculation of estrogen is the biggest problem that causes a variety of the complications, and we do not want that. And the gut health and the liver health will prevent us from those kind of issues. So she came back on the third visit. She felt stronger. Her energy was back and she was able to exercise. She's now lifting weights and rebuilding her muscles. She wants to start their bioidentical hormone replacement. We started on the lowest possible dose of continuous estrogen and progesterone. And we follow up. The follow-ups usually in this case will be in 3 months with a salivary test. So some women would need adjustment of hormone. But when we're starting women on hormone replacement therapy, it's always the first follow-up is in 3 months with their proper testing. So on the fourth visit, she came back with the blood, with their salivary test. We look at her hormones and they're very stable and they all mid-range, which is where we want it. We see that her estrogen is in the mid-range, progesterone is in the mid-range, and testosterone. Her sleep improved, her energy got even better. She does not have any more menopausal symptoms except for some vaginal dryness. So I'm sending her away saying, good, look, you're stable on this dose. You do not need to come back for 6 months. But in 6 months, you do need to come back with the test before you visit. So we know if we need to up the dose, lower the dose, keep you on the same dose. And of course, all necessary scanning tests like a breast health or pap smear or all the cancer screening tests that we offer in our practice, and we offer a variety of things now, not just conventional screening like colonoscopy or Cologuard or mammography and pap smear. We offer something even deeper and more precise, like a test that measures a signal of the cancer in the blood. So some women do prefer to know that they don't have any cancer by doing the blood test instead of other things. But so it's again, it's not one size fits all. Everybody's different. And this is what I want you to take away from today's discussion, that we are all different. We are different age, we're different ethnicity, we have different needs, and we have different demands. And the management of hormonal variation should be really customized in partnership with your practitioner. Well, where do you find a good practitioner, right? I do recommend people to go to the ifm.org, which is my alma mater. This is where I learned functional medicine, and find a practitioner who is certified, who is not just took one course and put themselves on their website, but someone who took time, completed 2 or 3 years of studying, took the exam, passed the exam, and became certified IFM practitioner. In our practice, we have Marina Kucher, who is a certified functional medicine practitioner, and myself. So if someone who you don't know, maybe you want to find someone outside of the IFM, and that's fine too. But look for someone who invests in their education, who constantly studies, who constantly masters the art of medicine, because things progress. We learn new things, and we just can't stay on one spot. We constantly have to improve ourselves and learn new things to help our patients in the best possible way. And with that, I want to thank you for attending today. Please visit my medical store. Take advantage of this 10% off site-wide during the May. Use this code MAYQA10. And as you know, I'm now seeing patients not only in New York State, but also in Florida. I'm there every other month. And my next day in Florida, if you are listening this webinar from Florida, I'll be there in July 31st, and it's a Friday. And because we just celebrated our mothers and our women in general, I would like to offer you my Dr. Elena Essential packets at the discounted price. Why did I create this Dr. Elena Essentials? By scanning hundreds of patients, I noticed that there's 3 main ingredients or nutrients that are absolutely essential for women that will resolve many, many different issues. Everybody needs vitamin D and K because it's such a multifaceted product that we need it not only for our bones, but for our immune system, for our brain health, for our mood. It's absolutely irreplaceable. And many people are vitamin D deficient. So this is a great dose of a great concentration of vitamin D3 and vitamin K2, which are essential to be taken together. Everybody needs omega-3 fatty acids, such an amazing anti-inflammatory nutrient. Again, protecting your heart, protecting your brain, improving your mood, improving your during their winter seasons. People get depressed, many of them omega-3 fatty acid deficient. So excellent for brain health and just lowering inflammation. And of course, everybody needs active or activated B complex. This is the methylated B vitamins that help with so many different functions. So those three nutrients, I don't want you to leave the house without. And that's why it's in the small packets that you can put into your bag or your purse and take it any time of the day. It's absolutely wonderful, easy, and you're going to save a lot of money by doing it this way. That's why I created it, so everybody's covered, because it will make my job easier and your life better.